Hey Dental Fam, it's your girl Leela. Who else? And welcome back to
The A Study Spot, yeah.
So as you may or may not have heard, today we are breaking down tooth numbering systems and tooth surfaces. Two things that always show up on a DANB exam and shows up every day in the dental office. So grab your notes and your typodont if you have one. We are going hands-on today, baby. Let's start with tooth numbering systems because depending on where you work, you might see a few different styles. The universal numbering system is used in the US, which means permanent teeth are numbered 1 to 32. So we always start at the upper right third molar, number 1, move across to the upper left third molar, which is number 16, then drop down to the lower left third molar, number 17, and count across to the lower right third molar, 32. Now the primary, aka baby teeth, are labeled with letters A through T. So we're still starting at the upper right with letter A, move to the upper left with J, then lower left K to the lower right T. You'll see this on pediatric charts or when assisting during mixed dentation cases. The mouth has two arches, the maxilla, which is the upper jaw, and the mandible, which is the lower jaw. Now, the Palmer system is quadrant based. Dentists love using it for ortho and restorative work. Each quadrant has its own symbol and teeth are numbered 1 through 8 from the midline. So starting from the upper right incisor or number 8, going back to 7, 6, 5, 4, 3, 2, 1, which is the wisdom tooth that would be here, that would be 1 quadrant. Then upper left starting at number 9 to number 16 would be the second quadrant. Then down from 17 over to 24 will be the third quadrant. And then 25 to 32 is the fourth quadrant. Pro tip, Palmer uses quadrant brackets plus numbers, so it's perfect for quick notes during ortho. Finally, the FDI system used worldwide. Each tooth has a 2-digit number. You can still say it's quadrant based, except now number 8 is 11, 9 is 21, 24 is 31, and 25 is 41. And again, because it's 2-digit, we're counting from 11 to 18, 21 to 28, 31 to 38, and then 41 to 48. So if someone says tooth 36, that's the lower left first molar. Got it? Now let's talk tooth surfaces because when charting, this lingo is everything. Did you know that each tooth has 5 surfaces? Yes, let's talk about them. Now the anterior teeth and the posterior teeth all have 5 surfaces, true, but they don't all have the same exact 5 surfaces. This is the midline and the mesial surface of the tooth will always meet the midline, which makes this the mesial for number 8, number 9, 7, 10. So all the teeth have mesial surfaces. So this is number 6 mesial, number 5 mesial, number 4 mesial, 3, etc. They also all have distal surfaces, which is away from the midline. So this is number 8's distal, number 9's distal, number 7 distal, 6, 5, 4, etc. So we know of 2 surfaces already on the anterior teeth, which is the mesial and distal, and then we have the incisal. This is the biting edge of anterior teeth. This is the surface of a tooth that you use to bite into an apple, and you may see this restoration if there's a chip tooth. Posterior teeth has occlusal surfaces. This is your chewing surface. Tip: O, occlusal, is a chewing surface. I, incisal, is biting surface. Posterior teeth also have buccal surfaces. This is the cheek side of your posterior teeth. However, your anterior teeth has labial surfaces, which is the lip side of your anterior teeth. And then just like the mesial and distal, all your teeth has lingual surfaces. This is the tongue side of all teeth. So when doing an MOD or mesial occlusal distal filling, it'll start to the front, go across the occlusal chewing surface, and then to the back distal of that tooth. Kind of like bone shaped. Exam tip, always remember mesial meets midline. That's how you know which side is which. All right, quick recap before the quiz. Universal equals 1 to 32 or A through T. Palmer equals brackets plus numbers or quadrants. FDI equals 2-digit system, so all teeth has 2 digits. And last but not least, tooth surfaces. M for mesial, D distal, O occlusal, I incisal, B buccal, L labial, L-I, lingual. Keep these straight and charting will be a breeze. All right, y'all. Now that we are completed with that, let's test your memory real quick with the pop
quiz.
Number 1. Which tooth number is the lower left second molar in the universal system? Number 2. In the FDI system, what tooth is number 11? Number 3. What does DIL mean when charting a filling? Be sure to download my free comprehensive universal charting system that I have linked below in the description box. It covers all permanent and primary teeth, surfaces, arches, quadrants. It also contains a blank universal chart. That way you can fill it in and do some practicing. It is going to be free for the first 20 downloads, so make sure you get yours ASAP. All right, if you said the answers are number 1, 18, number 2, upper right central incisor, and number 3, distal, incisal, and labial, you are correct. How did you do? Drop them scores in the comments and let me know. If you found this video helpful, give it a thumbs up and share with someone that needs a little bit of help with tooth numbering and surfaces. And I'll see you in the next video where we talk about instruments and their purposes. Bye.
The A study spot, yeah.